Hello to everyone. My name is Pastor Pass, pastor at Brighton Rock and Zion Church in Portsmouth, Virginia. And thank you for being here with us, and thank you for joining in with our B-Rock fight against COVID-19. For the past several months, we have been partnering with community partners, with like-minded, just trying to stay in this fight against COVID-19. So thank you for being with us today as we continue to give you updates and maybe even some safety tips regarding COVID-19. We have a special guest with us today, which I'm very excited to have, Nurse Lorianne Lewis with us today. And she is going to come and bring her expertise with us. Nurse Lewis has been a nurse for the past 32 years, and with a background in the operating room, emergency room, nursing management, and as an instructor. And so she comes with a wealth of knowledge. And so she's going to bring us up to speed because we know there's been many changes with the COVID-19 and some that's still the same. So welcome, Nurse Lewis. How are you today?
I'm great. How are you?
Great. And thank you for joining us. And we're going to share in some questions, just some dialogue with our partners in the community who continue to want to know more about COVID-19 because it's still with us. We're hearing with our neighbors. I just the other day, my neighbor called and said, there's several of us here that have COVID-19. Mm-hmm. My sister's in Seattle. She and her husband both had COVID-19, and everywhere I hear it just keep popping up. And so if you could just share with us some basics of how COVID-19 is spread, we'll start there.
Okay. As we know, COVID-19 has been around for about 2 years now. So I think people have kind of gotten out of the, gist of how it spread. So as Dr. Pass was saying, basically COVID is spread through sneezes and coughs. Thus is the reason why they're saying that you should wear a mask to help as a protective barrier. Also, it can be spread if, you sneeze, you cough, you touch a surface, and on that surface is the virus, then you can catch it that way. But that is not the main mode of transmission. The main mode is basically, as I said before, is through sneezes and coughs.
Wow. That's kind of still the same thing. And I've been noticing people coughing and sneezing. Even when my grandchildren do it, I'm going, wait. You have got to either put a mask or cover it, even in your elbow or something like that. Right. Yeah, exactly. So my kids, I'm noticing that my grandchildren are doing that. So if you could share with us, like, when is a person considered infectious? Like, a lot of times people don't realize it is COVID until several, days into not feeling well. So when are they considered to be infectious?
They're finding that a person, let's say I start having symptoms today. So basically 2 days ago, I was infectious. So they're saying it's 2 days prior to actually you starting to have symptoms. Mm-hmm. And then if you don't have symptoms and let's say you just go and get a test done, then they say you were basically and your test come back positive. You were infectious 2 days prior to that positive test. So that's why it is so important that you if you're feeling bad, you kind of quarantine yourself because you could have had it and been exposing people and not really know.
Right. So I'm hearing that after the booster, that people are really feeling like they have a head cold or something like that and not really feeling terribly sick.
Right.
Particularly if you've had, the shot and the booster. And so we just need to be more careful with that.
Yes.
Great. Yes. What about some of the stats that's out here now? Could you share a little bit about what our numbers are looking like?
Yes. Okay. So back in December, when the Omicron BA2 first kind of hit the United States, we had high levels of COVID cases. Mm-hmm. And then in April, the numbers had started, like March, April, the numbers had went down because in April, we only had 3 new cases that was reported in Virginia. Mm. And then May, they start to climb back up. Now they're starting to climb back up. May 31st, there was 989 cases reported. And June 20th, there was 1,733 cases reported. And then just on July the 6th, there was 3,828 new cases reported. And they're saying that those numbers could be even more because a lot of people are doing home testing, but they're not reporting the results.
Wow. Wow. So we're seeing those numbers creep back up.
Yes, there is definitely a surge coming back up.
Wow.
I'm Dr. Keith Newby. I am the Medical Director of Health Equity with Centera Healthcare and the President and CEO of Fort Norfolk Medical and President of the James E. Newby Jr. Foundation. I'm here today to talk to you a little bit about COVID-19. And trust me, I know you're probably tired of hearing about COVID. You've been dealing with this for, 2-3 years. But why is it important? Why do we keep bringing it up? Because it's not over yet. We are in a better place, but we were in a better place a year ago where the case and load were starting to fall down. But then what happened? Delta came out, and all of a sudden the cases escalated again, and they started dying back down again. And then what happened then? Omicron came up, and then it really escalated then. So it's important that we continue to talk about COVID-19, and we continue to say to ourselves, no, it's not over. Things can change and things can go south pretty quick. So why is this important? Because the virus is what it is. It mutates, it changes. I mean, because the virus's job is to survive, and the COVID-19 is trying to survive. And what happens with vaccines are designed to help your body fight or to develop an immune response to fight COVID-19, but that virus is trying to evade it. So that is why it's so important that we take certain precautions when we're dealing with COVID-19. Wearing your mask. I still wear my mask everywhere I go. Why? Because I feel strongly that COVID-19 can still impact lives. I've seen 80 plus patients in my practice die of COVID-19. 80 plus, and that's all that I know about. I've had family members die of COVID-19. I've had close friends of mine who have died of COVID-19. And when you have that kind of impact on your life, the stress that is brought about, this is the time that we have to be diligent to not let our guard down, because we want to live, and I want to see you live. So, and why is this important for our community? Well, if you look at data, it says that the African American community is 2 to 3 times more likely to both contract, have complications, and potentially die of COVID-19. Why is that? Because of our particular lifestyle, our chronic medical conditions that we have, the things that doctors like myself have been trying to get you to do better with, and making sure that if you're diabetic, that you're getting your blood sugar under control. If you have hypertension, that your blood pressures are under control. If you have coronary disease or certain heart conditions, that you're doing what you need to do, both medication-wise and lifestyle-wise, to make that an important improvement in your life. These are things that help stave off COVID-19. Now, vaccines. We're going to talk a little bit about vaccines. I know for a lot of people that is a dirty word, and I've brought this up time and time again, that we have got this come to this conclusion that the word vaccine means something bad. Well, let me share this with you. I've had the COVID-19 vaccine. My whole family has had the COVID-19 vaccine. Everybody's lived to tell the tale. My 92-year-old mom has had all 3 of her shots, first, second, and booster shots. Her sister, who is 94, has had all 3. My sister, my brother, all my family members have had their vaccines. Why is that important? Because A, we want to live. B, we know through data that the vaccine is safe and effective. I don't care what you've seen on social media. I don't care what some outside news outlet has said to you. I don't care what even other patients have said to you. What I care about is what the data says and what the literature has dictated to us, that we know safety and efficacy of this vaccine. It's helped many people live, and it's helped many people stave off COVID-19. So one of the things that I do want to bring up as it relates to this vaccine, I want to make sure you understand what its purpose really is. How does the vaccine work? Look at it like this. When you have look at your antibody system as like an army. That army is designed that if somebody comes to attack your village, that you have enough soldiers that are going to respond and hopefully overtake that army so it doesn't overtake you. The vaccine's job is to build your antibody immune system to the point where you're like that competing army. COVID-19, it will replicate quickly. So when it gets into your body, it's trying to survive. So it's replicating quickly. Your immune system has to be strong enough to fight off that infection. So that means that the army has to be large enough to beat down COVID-19. If you've never been exposed to COVID-19, or if your antibody response is too low, when that COVID-19 affects your body, your antibody response cannot work fast enough to build this immune response to help keep you from getting COVID-19 or deal with those complications, or worse yet, that you may die. I've had a lot of patients who said to me, listen, I'm healthy. I do everything I need to do. I exercise. I take plenty of vitamins. And that's great. I'm glad you do that. But that has absolutely nothing to do with your body's ability to respond to something it's never seen. If your body, or even if your body's seen COVID-19 a couple of years ago, you're like anything else, unless your body's continuously trained to respond to a particular virus, it's going to take a while for it to rev back up your immune system. So no matter how healthy you are, and it's important that you are, but it can't overtake that virus if the replication of that virus can't work faster than your immune response can kick in. You have to have had some exposure to COVID in the past via vaccine, or even if you've had the COVID infection, you have to have enough of that vaccine, or that have had enough of that vaccine to build that immune response, or COVID-19 infection to build that immune response to react to the virulent particles to allow it to fight off that infection. If it was 2 years ago when you had the infection, your immune response has gotten blunted and is not ready to respond quick enough yet. So it's almost like if you're getting ready for a fight. I'm not going to get in the ring with Mike Tyson if I've not been trained properly. So look at it like that. Look at COVID-19 as like a fighter who's been well trained, and the virus is me trying to make sure I'm fighting off that infection. I have to be well trained. I have to exercise. I have to have my weight down, and I have to eat right and do all the things in preparation for that fight. So once I get into that ring, I have to be ready to be able to stave off my opponent. Now, say I had to fight, and say I won the fight, but and somebody challenges me to another fight a year later, but I haven't done any preparation. So I haven't been in shape, haven't done anything. What am I going to look like getting into that ring? I'm not going to look my best. And that is kind of what happens when your immune response starts to die off from COVID-19 infection. If you're not really ready for that fight again, it's not going to rev up fast enough to be able to fight off that virus. So these are the important factors that I want you to hear about vaccines. Don't look at it as a dirty word. Look at it as a way to save lives.
What do you know anything about the hospitalizations? Are those down?
understand with the Omicron variant that it is not as deadly as the Delta variant was, but it is more transmissible. So they're finding that there's more cases, but the hospitalization and the death rates are not as climbing as fastly as people are, becoming contagious with the virus.
Right. Well, that's something that we certainly have to be thankful for. So,
Yes.
but we got to continue to be careful. So, what about share a little bit about this the vaccination and what role does the vaccine play in all this?
Well, I always tell people vaccines are there to help you to prevent from getting really sick. It is not 100% effective. So it's not going to be 100% for it as, you're not getting it. But the role is to, if you do get the vaccines, to hopefully that you will not get as sick, will not require hospitalization, and hopefully prevent death.
Right. Well, absolutely. What about the booster? I've only had one. I've heard some people say they've had 3, but then they had COVID anyway. So what about the booster shot?
Well, the boosters basically, like the CDC recommends, 2 shots, 1 booster. They're saying a second booster if you're 65 and older or if you're immunocompromised. Because the variants changes, the boosters are there to help you with the different variants. They're talking strongly about fall, like in October, for a 4th booster because there's a new variant out, which is the Omicron 4 and 5.
Wow.
And they're saying that the Omicron BA5 is even more contagious, is the worst one so far. So they are looking at another booster shot in the fall just for that one. So over time, your body gets immune, so the vaccine isn't as effective. So they introduced the boosters to try to keep up with the different strains of the virus.
Wow.
So they are looking at another booster come fall.
Wow. Well, I thank you for these updates because I think that when COVID-19 first started, we thought by now we would be out of it. But I guess the professionals knew that there would be some type of lingering effect of it. And so we still got to learn to live with it. And so having these updates and professionals like yourself joining in the fight with us for our fight against COVID-19 has been helpful. So thank you for joining us. I wanted to say, is there anything else that perhaps I've missed that you want to share with our public today?
One thing that I was reading this morning, and I just want to kind of let people, get people to understand. COVID-19 to me is very similar to like when the flu first came out. There was different variants. They had to change the vaccines, to try to accommodate the different variants. So I think going forward, eventually we will get to that point where the COVID is going to be very similar to the flu, where we're going to get a vaccine. You would need a vaccine once a year to help combat the disease. It's, the long-term effects of COVID has been totally different from the flu in the sense that, people that have repeatedly had COVID or gotten COVID are not now experiencing long-term a shortness of breath. And, some people still don't have taste and smell like they used to. So we do need to be mindful of these things. And when we're out and about, we need to continue to wear our mask and continue to wash our hands, because these are the things we can do to kind of prevent ourselves from getting it. Or if we get it, we won't get it as severe.
Right. Thank you so much. You're so right. Once again, everyone, we want to thank our nurse, Lewis, for joining us today and sharing in some helpful tips and giving us the updates on COVID-19. We appreciate you. We appreciate everyone visiting with us. Thank you, Nurse Lewis. And for everyone else, please join us, Brighton Rock's fight against COVID-19. You can find us on Facebook and you can find us on YouTube. Join in the fight. Go and get your shot. Go and get your booster. Wash your hands. Cover your sneezes and coughs. Take care, everyone. Bye.
Bye.